Hi everybody, it's Dr. Ann Collins from Nourish Wellness Family Medicine in Indianapolis. Today is Saturday, March the 14th, and it's been kind of an interesting week for everybody, hasn't it? I thought it might be helpful and useful to just send a message out. This message is intended for my patients and also for anyone else in the Indianapolis area that either is part of the Nourish Wellness Center community or is just looking for more information. So we're all obviously in the midst of preparations and management of this pandemic caused by COVID-19, which is a virus that originated in December and is a new virus. So it's something that we're all learning about as we go. And I know there's been a lot of changes in the way that the health officials are asking us to live life right now, and that can be really confusing and a little bit upending for people. But I want you to know that while there are some things that we don't have control of, there are a lot of things that we can do to help, and I want to share some of those with you today. So as you may have heard, the illness itself, COVID-19, is very much like the flu in the way that it presents, and so it can be confusing because we're also seeing a lot of flu cases currently in the Indianapolis area as well. So it's difficult to separate, and because at this time we have limited testing available to us, that can make that even a little bit more confusing, even from a healthcare provider standpoint. So this is the reason for the request that people are staying home and avoiding being in large groups, avoiding gatherings at schools and at churches and sporting events, concerts, things like this, so that we can hopefully help reduce the number of exposures by limiting the exposure of people who may have mild illness, so people who may just have a little bit of a cough or congestion, and they may just think, oh, it's just a cold, it's okay for me to be around people. Right now it's really not, until we have testing available, so that we can help differentiate and help know more clearly who really needs to be in a strict quarantine and who maybe has an illness that is less concerning or more common, like our typical cold viruses. Right now in Indianapolis, and we're hoping that this will change, right now testing is still fairly limited. We are working with outpatient labs, so LabCorp and Quest, who are two of the large non-hospital labs, so the labs that we can use independently, are working on getting testing available. Although at this time, though they've said they will ship to us, we have yet to receive any tests at Nourish Wellness Family Medicine. The hospital is able to do testing, however, they are limited to very strict criteria by the Indiana Health State Department at this time. Once more testing kits become available, there are plans in place to develop some drive-through and other testing facilities that will allow us to test more people, which will be super helpful when we're able to get that in place. That'll help us to know who does and who does not have a carrier status or the ability to pass this illness to other people. Right now, while we're waiting for those things to get ramped up, the best thing that we can all do is to try as best as we can to limit our exposure to other people, and also limit our interaction with other people, especially if we have any kind of symptoms at all. So that would be any kind of fever, any headache, any nasal congestion or cough, any issues with shortness of breath. Those are the primary presenting symptoms that we see with COVID-19. And as you can tell, those are very, very similar to what people have when they have a cold or the flu. And sometimes we can be a little bit more laissez-faire, I guess, about those symptoms normally. And in this situation, it's really important that we not do that. I'm going to show you a graph to help everybody understand a little bit more why that's really, really important right now. So because we have very little, or actually no, what we call herd immunity, so for example with the common cold and with the flu virus, a lot of folks in our community have had those illnesses previously, and so they have at least some immunity to them built up. So when we have the annual flu coming through, or when we have the cold viruses coming through, generally speaking, although we have a lot of folks who do get sick, usually it's not everybody at one time, because we've got a baseline immunity in the community, so we're not having large numbers of people get sick at the same time. With COVID-19, because this is a brand new illness, there is no vaccine available yet, although that's in the works. And so none of us have been vaccinated, none of us have had that virus before, so our body has not had the opportunity to make antibodies against it. Most of us who are healthy, most of us who do not have chronic illnesses and who are under the age of 70, if we get the virus, which many of us may, it will be just fine. We're going to have flu-like symptoms, most likely. People may be sick for a couple of weeks, and most of those folks will be perfectly fine once they move through that. The concern is that for our elderly folks in our community, for our elders, and also for our patients and people who have chronic health issues, so that's going to be people with diabetes, heart disease, anybody with asthma, COPD, or lung disease, anybody who is being treated for cancer or using other medications that may cause immune suppression. These folks are much more susceptible to having a more severe episode with this infection and requiring hospitalization. And it's really, really, really important that we protect these people in our community from getting the illness to begin with, but also it's really important that we help to reduce the rate of infections so that we're not getting lots of folks getting sick at the same time. This graph that was put out by the CDC is helpful, I think, in understanding this. So we may very well have lots of cases, but if we can have those cases over a longer period of time, this blue zone here, this is what we're shooting for. This dotted line here is the capacity of the healthcare system. And if we get lots of people at the same time, so this is this red zone here, what we're concerned about is overwhelming the bed capacity and the physician capacity actually as well at the hospitals primarily. If we can slow the rate of infections, and the way that we're working on doing that is trying to limit our interactions with each other in groups, that will really help to keep everyone safe. So you can see if we can take the same number of people but spread it out over a longer period of time, then all those folks are going to be able to be cared for adequately in the hospital. And that's going to really increase their risk of a good outcome and survival of the illness if they do get infected. So the things that we can do currently are to take seriously the recommendations to limit our activities in groups. If you are healthy and you need to go out to the store or take care of things for work, those types of things, that's okay to do. But our goal is that we're trying to minimize close contact, and those who are able to telecommute or work from home, that's advisable at this time. I know a lot of folks are dealing with trying to sort out what to do since there are kids home from schools and colleges, and everyone's having to kind of juggle to reorganize plans, and that does take some organization. But one of the things I really love about our Indiana community is that folks are great about supporting each other. And I know that we're all going to be really creative about helping people in our family and also helping people in our neighborhood to be able to make sure that everyone's cared for. So I really encourage you to check in with any elder folks in your neighborhood or in your family and make sure that they're heeding the recommendations to stay put, to stay at home as much as possible. Those folks could benefit from assistance. Younger, healthier people might consider offering to go to the grocery store for them or make sure they've got all their medications if needed. And then also just using FaceTime and things like that so that people don't feel socially isolated is really a great idea at this time. So we can have a little bit of fun with it, right? So trying to find ways within your home, usually we're all so busy and so distracted that this is, in a way, it's a little bit of a blessing because we get to have some time with a little bit more time with family potentially if you're going to be at home caring for children or just home making sure that you're safe. But also maybe some time to consider unplugging and just really connecting with folks, which can be actually a super beneficial thing. So it's important to stay up to date on the information, but I'd encourage you to avoid getting kind of sensory overloaded with the news. It's really easy for that to happen, and that can increase our stress levels. Right now we're dealing with the pandemic of the viral infection itself, of the COVID-19 infection. But from my perspective, we're also really dealing with the kind of epidemic of anxiety that everybody is experiencing because of this change in just what we need to be doing right now. It's very unsettling, and that can create a lot of sense of fear and upset. That type of anxiety can be injurious to your immune system. So it's really, really important that we're focusing right now on managing stress and trying to find a positive outlook or a silver lining to the experience. So maybe think of it as remember when you were 12 and you got a snow day, right? So try to put it in that perspective and see if you can find some fun things that you can do that maybe you don't normally get to do. Maybe get out the board games, or find time to call a friend that you haven't spoken to in a long time. Maybe write some letters to people that you've been meaning to write and haven't had time to do. But really taking time to make sure that you're focusing on getting adequate sleep, adequate nutrition, making sure that you're following the guidelines on hand washing. So doing a nice long hand wash in soapy water anytime you've been touching, particularly outside of your home, or if there's someone in your home who's ill, you'll need to be doing that frequently as well. Always before you eat and drink, it's really important to wash your hands. And try as best as you can to get out of the habit that most of us have of touching our face frequently. So that's a super common unconscious habit that most of us have, and that can increase the risk of contamination of the facial area. So we really want to avoid that as well. So I know it's a challenging time right now, and at Nourish Wellness Family Medicine, we are here for you. I want you to know we're going to be on our regular schedule for our patients, so we are in the office. We are dealing with some challenges right now as far as getting adequate personal protective equipment. So those are things we're working through, trying to get that. Our suppliers are trying to keep up, but they're having a difficult time getting that equipment to everyone. So we are doing our best to protect all of our patients as they come into the office, and also all of our staff members. Doing a lot of extra cleaning and disinfecting, which is done normally anyway, but we're doing that to an even higher level than typical right now. What would help us a lot is if you are having respiratory symptoms and you need to come in for an appointment, please call and let us know, obviously, so that we can be prepared for you when you come in. And know ahead that as of today, we are not able to do COVID-19 testing at the office. However, that will change with time, I believe, and we will definitely give you an update when that changes. And also we'll try to keep you apprised of opportunities within the community that may be doing some of the drive-up testing that we're hoping gets enacted. So as of now, and today is Saturday, March 14th, this is a very fluid situation, so by the time we get back in the office on Monday, it's possible that we may have more access to those test kits, which would be tremendous if we do. If you have needs for any other health issue, we are also in the office as per normal schedule. If you are uncomfortable coming in at this time for your routine screening testing, so if you're coming for your annual physical, or if you're coming for routine follow-up on something that is well controlled at this time and you don't feel an imminent need, it is perfectly fine if you would like to reschedule that. We completely understand that. Please, if you can, give us as much notice as you can, just because, especially for the physicals, there's a fair amount of pre-work that I do to prepare for that, and if we can know that that's not necessary at this time, then that will free up some time for us to help work with some of our people who are sick as well. So we are here for you. You all of my patients have my cell phone number, so you can reach me at any time if you have concerns. We are experiencing kind of high call volume, so please be patient with me as I return those calls. I'm trying to get back with everybody as quickly as possible. But I am here, and we're working diligently to support you, and also to work with our partners and colleagues here in the Indianapolis area on helping with the overall effort to aid the effort to try to reduce exposures, but also to treat anyone who does become ill. So we're here for you. We love all of you, and please just take a deep breath, because I know it's been a bit of a trying time for all of us. But take a moment to find that silver lining and see if you can use this time in a way that feels really positive to you. Find ways that you can disrupt any stress that you're having. Think about trying to stay informed, but not spend a whole lot of time reading articles or listening to the news over and over and over, because that can definitely raise the stress levels. Reduce your exposures as possible. If you are ill, please stay home, as far as not exposing other people in the community. And really consider strongly not being around elder folks in your family or community if you do have any illness. If you have symptoms of fever, cough, headache, shortness of breath, fatigue, those are all potential symptoms. And so if they're mild, again, shelter in place, as we say. Give us a call at the office so we can help advise you. And as testing is available, we will definitely work to help getting those who need to be tested. If you are able to manage, if your symptoms are mild, the treatment protocol for COVID-19 is the same as with the flu. There's no, other than that, we don't have an antiviral like we do for the flu. So the good old, soup and fluids and rest and Tylenol for your fever, and considering increasing your antioxidants like vitamin C can be super helpful. There's lots of wonderful ways that you can help support your immune system, including getting good sleep and interacting with those that you love, and helping make sure that you're not getting yourself too stressed. So, and that I think is the biggest thing right now. I also just wanted to make one comment about what we're seeing at the stores and the grocery stores right now. It is understandable that everybody is trying to be prepared. Right now, we're not seeing any disruptions in deliveries to grocery stores and things like that. But what we are seeing is a lot of folks buying a lot of supplies, and then that's creating a scarcity that really doesn't need to be there. We need to make sure that we're keeping maybe a week to 2 weeks of groceries at home, so that if we need to self-isolate, that we're able to do that without having to go out. But there are a lot of delivery services like Shipt and other grocery delivery services, Instacart, that can deliver things to your home if you are housebound. So please resist the temptation to buy, a year's worth of toilet paper, because that's creating a situation that's really adding to the stress in the community. So it's important for us to honor being prepared, but also to honor using only what we need and allowing the others in the community to have access to what they need as well. So please keep that in mind as you're considering your purchases and your preparation. We're all used to snowstorms, we're all used to tornadoes, we're not used to viral infections. With the virus outbreak, there's really not going to be an issue with any kind of water system or power system. We should still have functioning grocery stores, and all of our services that are here in the community are still expected to be functioning normally. So we should have normal access to supplies. So try to take just what you need, and honor that there will be other people in the community that also need to have some toilet paper or tissues or whatever staple is there, and know that the grocery store is going to get replenished, and there will be more there next week when you go back for your normal trip, or in 2 weeks. So preparation's good, but really please avoid hoarding, because that's going to create an issue where we have more people stressed because they can't find basic needs, and we don't need to create that. We can trust that those things will be available to us and allow and honor the needs of others as well. So I'm thinking about all of you. We're all in it together, and please know that you can reach me when you need to. For those of you who might be seeing this who are not patients of the practice, please make sure you're keeping in touch with your personal physician as needed. If you have symptoms, please also be patient with them, because they are surely managing quite a bit of volume as well, and everyone is here to support you. So trust that is the case, and I think we're all going to get through this fine. We just need to be sensible, not overreact, make sure we're taking good care of ourselves, and at this point in time, remembering to isolate if we have any symptoms, and generally for those of us who are healthy right now, make sure that you're also trying to respect those recommendations as far as not gathering more than necessary, minimizing interaction in social settings and churches and schools and things like that for the moment, and try to focus on things that you can do at home that, maybe we'll have lots of clean closets and basements, right? And all the mulch will get laid before the spring comes. So get some sunshine when you can, get outdoors, get some fresh air, but try to limit your interaction in large groups. And also please watch out for the elders in our community. Make sure that you're checking on your neighbors, call them, make sure they don't need anything. If they do, please offer your assistance and help them to stay in their homes so that they don't have to be out in the public. That's going to really help them a lot, and it's going to really help the healthcare system a lot as well. So I will give you another update as soon as we have more information, which will probably be in it, probably even as early as Monday. I wanted to give a shout out to Kelsey Martin, who helped me, coached me on how to do a video message. So thanks a lot to Kelsey. I'm definitely learning on the learning curve of this. So thanks again for your patience with the relative amateurness of the video. So, but we love you. We want everybody to be healthy and safe, and we want everyone to try to focus on getting through this in a way that everyone feels supported and is able to manage their stress and anxiety as we go through this. So be well, and you'll hear from me again soon, and give us a call at the office if you need us. And we're here to support you. Okay, take care.